There are a lot of facial foramens in the skull and in the facial bone. They contain and transmit a lot of important structures. We have four main foramens in the face that are important in our aesthetic procedures. We have the supraorbital foramen, infraorbital foramen, mental foramen, and the zygomaticofacial foramen. We are going to talk about each one of these four foramens briefly. For the supraorbital foramen, it is located under the eyebrow, a little bit medial to the mid-pupillary line. A lot of patients, they have this foramen incomplete, so it will form a notch. The notch is usually wider and more central. It is located in the frontal bone. It transmits the supraorbital vessels and nerves. How would you locate the supraorbital foramen or notch? With using your thumb, you will locate the orbital rim. Slide your thumb under the rim and you will find the notch or foramen. What is important clinically with this foramen? It's very important during the neurotoxin injections. Once you want to inject the corrugator muscle, please hold with your thumb this foramen or notch and close it to prevent the transmission of the neurotoxin into the levator palpebrae muscle. So this is our supraorbital foramen or notch. We are going to talk about the infraorbital foramen. The infraorbital foramen is located around 1 centimeter below the orbital rim. Try to palpate the orbital rim in the mid-pupillary line. 1 centimeter below the infraorbital foramen is located. It is found in the maxillary bone. It transmits the infraorbital vessels and nerve. It is one of the important structures that we have to avoid once we inject the hyaluronic acid fillers for the tear trough area. Please always be aware that this foramen is quite wide. For the zygomaticofacial foramen, it is located in the lateral border of the zygomatic bone near the orbital rim. It transmits the zygomaticofacial vessels and nerves. Sometimes in some patients it is absent, some patients they have it doubled, and the others they may have it a little bit higher. For the mental foramen, it is located in the anterior border of the mandible. It has different variations in its location. Sometimes you can find it near the oral commissure and sometimes a little bit lower. We are talking about this area. This foramen, the location for this foramen definitely it will be different based on the age. It may be lower or higher whenever the patient is older or younger.